When you see a joint that has arthritis in it, it's telling you that it's a joint that was damaged and it was not restored to its normal function. And nature said to itself, self, you don't want that to work? Okay, we'll just take it away from you and we'll allow it to deteriorate. So something's either working as it should or nature's in the process of taking it away. So if arthritis is nature's attempt to stabilize and cause to no longer function a joint, what can make better sense than putting motion into a joint that's not functioning as it should? And that's what chiropractic is. And so if you know somebody who is suffering from arthritic changes, it would be really the Good Samaritan thing to do to tell them about chiropractic, because most people don't know. And what most people do is what we've been taught to do, and that is use such things as Tylenol. And this is a reprint of an article that I'm going to pass out to each one of you. It was in Time magazine a couple years ago, and it was written by a medical doctor who was reporting on a study that was conducted at the Texas, it was at the University of Texas Southwestern Medical Center. And what they did was they found in this study that 38% of all the liver failure that they were seeing in the hospitals were caused by the overuse of Tylenol. That's because people think that if you can buy it over the counter, it must be safe to use in any amounts. And people are eating this like M&M candies, as you probably maybe even know somebody who does that. And so I'm going to pass this out to you. Each one of you can take one. And if you know somebody who's utilizing Tylenol, you might want to talk to them about that, because there are some safety factors that they need to be aware of. The second thing regarding arthritic changes is something that affects the discs in your spine. What most people don't know is that after the age of 16 or 18, there's no blood supply to these disc materials. The only way they get nutrients at that time, after that time, is by the movement of the spine pumping the nutrients in and out of the disc. If the joints aren't moving as they should, we can't get the nutrients into the disc, and then the disc begins to die. And so frequently we see patients coming in, and no longer do they have a proper space like that, it's looking more like that. It takes about 5 to 7 years to go from there to there. It takes about another 7 to 15 years, depending on the individual, to go from there to there. The exciting thing is that the most recent research is showing that by adding movement chiropractically to that joint, we can actually restore joint function. And then adding some nutritional supplementation, we can actually put the nutrients into your body that it needs to help rebuild disc height. And that's a really exciting thing for people that are having degenerative disc disease. By now you should be asking yourself, or saying to yourself, Dr. Hall, you're making some good sense. There's two things that happen when joints don't move as they should. It's good that chiropractic makes those joints function as they should. Tell me this, Dr. Hall, what makes these joints stop functioning? Every single one of my patients that I've had since August 2nd, 1982 are in my clinic because of one thing. But that one thing is very, very complex, because there's many causes of this one thing. And that one thing is stress. Now you're saying to yourself, stress? I was involved in an automobile accident. Well, how stressful do you think this sort of situation is? Boom, boom. Where your head is thrown back and then accelerates forward, so it has the equivalent weight for about 1/100th of a second of over 100 pounds. Try suspending a 100-pound weight from your head and see how long it takes to damage the neck musculature. All right. What I'm talking about are the stressors in your life. I don't have to tell anybody that there are a lot of different types of stressors, but let's talk about these. First of all, there are mental stressors. Think about any of these that you may be having at the present time. Anger, anxiety, frustration, depression. We all have anger, anxiety, frustration, depression. Why? Because life is hard. And we all have a certain amount of anger and depression and all of these different things at any particular time. What do these mental stressors do? They make muscles contract. What happens when a muscle contracts? It can't do what it's designed to do, which is to move a joint. When a joint doesn't move, it swells, compresses on the nerve. We've got a cycle from a mental stressor. But then there are biomechanical stressors. such things as slips and falls, auto accidents, lifting accidents, these sorts of situations. Then there are underactivity stresses, such things as not enough exercise. Then there are chemical stressors, such things as the poisons in the food that we eat, water we drink, the air that we breathe. There are even thermal stressors in our society. You know, it's 105 degrees in the summer in Texas, and then how many times a day do you go into 70 degree? You know, we've only had air conditioning for about 100 years. It's not normal to go from 100 degrees to 70 degrees in 1 second. Right? That's a stressor to your body, believe it or not. So what you want to understand and remember is all these stressors in your life are cumulative and add up and help lower your health index towards that threshold of dysfunction. I want you to know that when I met each one of you, I was thinking of a goal. And my goal, number one, is to help every one of my patients get to a point of maximum chiropractic improvement. In other words, I want to help your bodies become as strong as they can be. You'll notice each time you come in, I'm performing a diagnostic exam called motion palpation. I'm actually talking to your backs and your necks or your shoulders, your elbows, your knees, your ankles, whatever it is that's been damaged. And it's telling me which way I need to move it and how to move it. And when it tells me after your visits that it's getting better, we'll see you less frequently. And when it tells me that it's reached a point of maximum improvement, well then we're going to have a conversation. Because I have a dilemma. And the dilemma that in my life is that I can't take away these stressors, Luis, from your life. I can't take the anger, anxiety, frustration, depression, the biomechanical stressors, the chemical stressors, or the thermal stressors. I can't take that away, and I can't keep the cycle from getting started once again in your life. And so I came to this decision back in 1982 that I had to create a program that will allow people to stay healthy once I help them get healthy. And so I created a program that I'm going to invite each and every one of you to take advantage of when you get to that point, because I invite all of my patients, and that is something called the Stress Relief Program. The Stress Relief Program is designed to do that, just that, is to keep individuals and families healthy and strong. It's very simple. It allows you to come in once a week to get an adjustment, to get a therapy. It's only $49 a month for one person. 2 people can come in for just $64 a month. Families of 3 or more, Felicia and Daryl, for just $74 a month. We literally have people bringing in children, 5, 6, 7, 8 of them on a weekly basis to stay healthy. And remember, this is for wellness care. It's not for people that are ill, who are sick. It's for people that have got to a point of wellness and want to stay healthy. Does it work? I guess personal examples are the best. I've been a chiropractic patient since I was 3 years old. Why? Because my mother and father had an understanding back in 1957 of what wellness care really was, way back before they even had a name for it, right? And they wanted every one of their 6 kids to be as healthy as they possibly could be. And so I routinely received chiropractic care, not because I was ill, but from the time of 3 on, to stay healthy and strong. And I'm not saying this to brag, but I was born in 1954, and I've only been ill 4 times in my entire life. Why? It's not normal to get sick. If you keep your body strong, healthy, get proper exercise, nutrition, sleep, and keep the moving parts and the other functioning systems working as they were designed. Right? And so I want you to know right now that I'm going to invite each and every one of you to take advantage of that. We have hundreds of people who come in on a weekly basis, and I hope you join them too. Folks, you've been very attentive. I hope I've given you some information that you can use in the future that will allow you to live longer and better lives. God bless you, each and every one of you.